A healthy liver is absolutely essential to having good health. And October is Liver Health Awareness Month. And I thought I would dedicate this talk to fatty liver, which is the most common disorder of the liver seen in the United States and in Western culture, and certainly the most common thing I see in my practice. So that's where our liver actually gets infiltrated with fat. And in more severe cases, the fat can cause very, very localized inflammation that leads to liver cell disruption and elevation of liver enzymes entering the bloodstream. And this can actually lead to scarring and something called steatohepatitis. So there's more mild versions and then more severe versions of fatty liver. But what causes fatty liver and what can you do about it? So the main thing that causes fatty liver is metabolic syndrome and eating too many carbohydrates, not getting enough exercise, having a very sedentary lifestyle, and 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 so the same things that I always talk about that can help insulin resistance and reduce your tendency toward diabetes, heart disease, and cognitive decline also reduces your risk for fatty liver. So there's other things as well that now have been discovered that can lead to fatty liver. And in certain ways, these are related to the diet as well. So dysbiosis in the intestinal tract that can lead to an immune reaction against some of the organisms growing in the intestinal tract, and then ultimately to leaky gut can actually really damage the liver and lead to fatty liver, liver inflammation and fatty liver. So all of the blood that leaves the intestinal tract goes via the portal vein to the liver to be detoxified before it can go on to the rest of the body to bring nutrients to the rest of the body. And so that is why anything that's creating an immune or inflammatory response in the gut will ultimately affect the liver as well. So the liver has immune cells within it called Kupffer cells that can release inflammatory intermediates in response to bacterial-derived products that can be going from the intestinal tract via the portal vein into the liver. And it turns out that the diet plays a huge role in the health of the microbiome and kind of like the mixture of microorganisms that you have in the liver, excuse me, in the colon. And also it's been shown that small intestine bacterial overgrowth can put you at greater risk for fatty liver as well. So normally we're not supposed to have small bacteria growing in our small intestine, but if you have a lack of stomach acid or a faulty ileocecal valve, which is that kind of closure between the colon and the ileum, part of the small intestine, you can have bacteria from your mouth kind of entering and passing through the stomach acid environment unscathed and setting up shop in your small intestine, or bacteria from below in your colon kind of moving up through the ileocecal valve into the small intestine from below. Overgrowth of bacteria in the small intestine can cause a lot of problems, like including immune responses that can ultimately lead to leaky gut and the leakage of like bacterial derived toxins and whatnot into the portal circulation that goes to the liver and causes localized inflammation there. Now, your diet obviously plays a huge role, and increased fat in the diet can lead to a skewed microbiome. Increased carbohydrates in the diet can lead to a skewed microbiome. Too much alcohol in the diet can lead to both leaky gut and a skewed microbiome. So the best thing to do is to eat a diet that has moderate amounts of protein, lots of vegetables that have a high fiber content, and healthy fats in moderate to modest amounts. This is the type of diet that is going to lead to a diverse and balanced and healthy microbiome and is going to be least likely to causing leaky gut and problems in the liver. It also is a diet that is reduces your risk for metabolic syndrome and reduces your risk for insulin resistance, which is one of the very leading causes of fatty liver. So we understand now a lot more about the cause of fatty liver and what can you do for a treatment? Well, you watch your diet, like I said, but also consider supplementing with prebiotics and probiotics. There's some good studies that have shown that these things will reverse fatty liver. So, in the early stages of fatty liver, before moving all the way to steatohepatitis, there's so much you can do to turn this around and really restore the health of your liver, because you actually get a whole new liver, every few, I don't know exactly, but like number of weeks, because it has incredible regenerative capacity. So just really pay attention to your diet. And then, of course, you want to pay attention to other lifestyle factors, such as reducing, if not fully eliminating, alcohol consumption, and reducing the exposure to toxins as much as you possibly can by being mindful of your environment, being mindful of your personal care products, and and even the products that you clean your house with, etc. So there's so much you can do to have a healthy liver.